on Fluorosis Files with Mama Maji. We are at Mothersmile Dental Clinic. Come with me as we engage Dr. Salome Ireri, a pediatric dentist who has practiced in Nairobi for more than 3 decades.
My name is Dr. Salome Ireri, a pediatric dentist, in other words, a children's dentist. I work at Mothersmile Dental Care in private practice, but for the longest time ever, I've worked in the public sector, but most of my work life has been around Nairobi City. And I have practiced for over 30 years. For some reason, dental fluorosis numbers seem to be going up, or most probably could be because parents are more aware, but we've also seen, as we've had a sudden rise. Like I said, I've been in the city for very many years. So we've seen a certain rise in boreholes being sunk as these buildings have come up. The tall skyscrapers are all over in Kilimani, in Kileleshwa, in many parts of the city. So we seem to be having a higher number. And I must say parents are also aware, and so are the children. Yes, milk teeth can be affected by dental fluorosis, and although not as severely as the permanent teeth. And when we talk about milk teeth, we are talking about the first 20 teeth that come into the mouth by the time the child is 30 months old. And so for you to be, they escape a lot of distraction from high fluoride levels, but one can tell, especially if you look at the last baby molar, where if there is fluorosis, one will be able to tell. But generally, the milk teeth may be looking very nice. Then all of a sudden, when permanent teeth starts coming to the mouth, they look brown or they are breaking, which becomes now quite a big issue for the parent and the child. Well, if your child has white teeth looking very nice and white, like we said, the baby teeth don't get affected into a high intensity. So they may still be very white and nice, and even cavities or problem-free, they are not breaking, the color is very nice, but then the permanent teeth come into the mouth when they already have fluorosis in the whole range, may be very white, very brown, or breaking and sensitive sometimes. The parents need to know what sort of water they are cooking and drinking with from birth, preferably to about 8 years. But much more important is from around 2 years, because that is when the teeth are developing, when the teeth are still inside the bone. And I would like to repeat, and because this is a very critical thing, that the teeth get affected way before they come into the mouth. And the key thing to look out for is that you're having water to drink and to cook. A lot of parents are careful about the drinking water, but the cooking one, they may not necessarily be aware that it can cause a problem. So that is a very important thing to look out for. Because we have lots also of other dental issues, mainly about 1 in every 2 children will have a cavity. So fluoride in toothpaste is very useful in preventing tooth decay. So even when one has fluorosis, because it works topically, it works on the surface, it's actually safe and recommended that parents use toothpaste with fluoride for brushing teeth for their children. Yes, there is for all children, because also fluoride swallowed in high quantities can have negative effects. We say use a pea size of a toothpaste, or put just like a very tiny bit on the bristles, because the teeth are also few, they are quite smooth. So you need very little, so that even if some is swallowed, it has no negative effect. The healthcare workers are very crucial, because it's like a cumulative effect. The mouth, the teeth, the child is seen by many people. To start with, in the MCH clinics, the staff there can be very influential in educating the parents, or better still, referring them to have the first dental visit by the time the first tooth comes into the mouth, or when they are weaning the child at 6 months or so. Those are very good times because parents are given first-hand information by the dental professionals. So at that level, that's a very good point where they can either be advised, asked, or referred. Referred is also good because they are able to ask all sorts of questions to the dental professionals. We could also, the pediatricians have also upped their game, I must say, and we commend them and we encourage them to keep referring the children for first visits. They actually, many are doing that, which is a good thing, so we just need more to do that. And then finally, for the dental professionals, for a long time, there was concentration about preventing gum disease, preventing cavities, because that was the biggest problem. Now on our bucket list of preventive items, we all need to add prevention of fluorosis. And if I might repeat, we need to prevent it way before the teeth come into the mouth. Well, I like farming, but not farming of, like the old days farming, but I do a lot. I walk around, plant 1 or 2 things. I like the green spaces. And together with other things. For some reason, I'm still doing a lot of other things, maybe teach a thing here and there. Yeah, so I'm quite well occupied. Play with my grandchildren. Well, I like art, so maybe I would be an artist. Together for a fluorosis-free future.